fetal heart. It looks a lot like the adult heart, but a couple of interesting differences that we're going to go over. The first thing I want you to notice is that it's mostly got what I've drawn as kind of this purplish blood. You know, in the adult heart, we know there's a real clear distinction between oxygenated blood and deoxygenated blood. But in the fetal heart, it's all very, very similar. Now let's start by kind of orienting ourselves. This vessel at the top is different, right? It's got blue blood rather than this kind of purplish blood. And the reason for that is that this blood is actually coming back from the body, and the body has used up as much oxygen as it can. So this is the superior vena cava dragging blood back from the arms and specifically the head region. And you've also got on the bottom blood coming into the heart from the inferior vena cava. Now this is also coming from the body, but I've drawn it more pink. So why would I do that? Well, it's because you remember there's also, in addition to just bringing blood from the body, there's also blood coming from the umbilical vein. And I don't want you to forget that, because the umbilical vein is actually bringing really, really oxygen-rich blood from the placenta, and it's mixing with the inferior vena cava. So it's not bright red, but it's got this kind of pinkish tone to it, and this is really the only major source of oxygen that the fetus is getting, is from this umbilical vein. So this is actually very, very important. And that's why when it mixes with that blue blood from the superior vena cava in the right atrium, we get kind of this purplish stuff. And of course, let me just quickly label the rest of the chambers. We've got the right ventricle, the left atrium, and the left ventricle. And these are the four chambers, right? Let me also name the major arteries and veins. This, of course, is the aorta at the top. I've also got the pulmonary artery here, pulmonary artery. And we've got pulmonary veins. And I'm just going to label this side right here, pulmonary veins. But you can see there are two on the other side as well. So this is what the fetal heart looks like. And now let's actually think about what's going on in the fetal heart and how the blood is flowing through. So to do that, let me actually start out by drawing some lungs, because this is actually going to help inform the path of blood. So these are the lungs. This is, let's say, this is the right lung. The right lung. And of course there's one on the left as well. Let me just draw it in just so we don't forget that it exists. But I'm going to use the right lung for this example. This is our left lung. I even drew the little cardiac notch. And on the right lung, blood is coming in from, let's say, the pulmonary artery, right? So blood is coming in this way from the pulmonary artery. It's going to go into little vessels, little arterioles. I'll draw them kind of the same purplish color. It's going to go into little arterioles, and then it's going to get into little capillaries, right? Even tinier little blood vessels. And those capillaries are going to go and meet up with an alveolar sac. And these sacs in adults are full of air. But in the fetus, there's actually nothing but fluid inside of here. So it's actually just full of amniotic fluid. So it's just fluid filled. And so if you're thinking about it, do you expect the oxygen level to be high or low? Well, if it's full of fluid, amniotic fluid, it's going to be pretty low. There's not much oxygen there. In fact, blood isn't even going to the lungs to get oxygen, because we said that the main source of oxygen for the fetus is going to be from the umbilical vein. This is where the vast majority of oxygen is coming from. So what ends up happening is that because there's such low oxygen in the alveolar sacs, they have this process, this ability to actually cause the arterioles to constrict. So these arterioles have some smooth muscle on them, and they actually, the alveolar sacs, because of the low oxygen, they make this constrict. So it literally kind of clamps down, and it looks a little tighter, something like this, a skinnier blood vessel. And when it constricts, when you have a smaller radius on that blood vessel, what does that mean exactly? Well, it means that the amount of resistance went up here. And of course, if it happens once, that's not a big deal. But if it happens in millions and millions of arterioles all throughout the lungs, then what we're really talking about is that the pulmonary artery, both of them on both sides, are going to face really high resistance. And this process of kind of increasing the resistance when the amount of oxygen is low, remember we actually named this process. This process is called hypoxic, and that just means low oxygen. Pulmonary, referring to the lungs, hypoxic pulmonary. Vaso